So it is about that time, my friends, Doc Talk. Once a week, we take the questions that you send us and we pass them on to a doctor or medical professional.
Yeah, joining us live today to answer your questions is Dr. Leo Lopez with University Health. Dr. Lopez, thanks for being back.
Happy to be back.
Okay, so let's start with our first viewer question. This one was sent to us anonymously. It says, 3 months ago, I was diagnosed as pre-diabetic. Oh, excuse me, Rebecca. She's put her name on here. She says I had breast cancer in 2019 and was cleared in 2022. I feel my body has changed a lot, like weight gain. I've been the perfect weight over 25 years. What can I do?
Firstly, thank you, Rebecca, for sharing your story, and I'm glad to hear it sounds like things have gotten better with your breast cancer, so just wanted to acknowledge that. But yes, let's talk about prediabetes. It's really important. This is affecting millions of people across the U.S. In fact, about 100 million Americans have prediabetes, including 1 in 3 people right here in Bexar County. But about 80% of folks don't know they have it at all. And it's really important that we recognize that prediabetes increases our risk of things like type 2 diabetes, heart disease, and strokes. So often we've talked about right here on Doc Talk that prediabetes, the good news is it's reversible. If we can aim to lose about 5 to 10% of our body weight in the next year, we can potentially reverse prediabetes. And the fundamentals are, as we've discussed, that commitment to nutrition. We want to try and incorporate at least 5 servings of fruits and vegetables every day. Try to avoid those processed fast foods. And if you're looking for more structure and guidance, look to something like the Mediterranean diet. There's good principles, tips, and strategies there that can be really healthy for us. And the other part of it is exercise. For adults, we want to try and get 150 minutes per week. That's something as simple as a walk, 20 minutes every day or 30 minutes every 5 days. And then we want to manage our stress and get good quality sleep. For adults, again, about 7 to 8 hours of uninterrupted sleep.
So if a lot of people don't know that they have prediabetes, what are the signs of that? What should we be looking for?
Sure. So sometimes there are no signs at all. So we want to, if you are concerned about your weight or really just concerned about your health generally speaking, connect with your doctor, see about getting screened for diabetes. And there are different options out there for screening. So definitely recommend folks reconnect with their healthcare team.
All right.
Okay. Now let's move on to the next question. It comes from Olivia M. She says, my fingers on my right hand keep locking and they hurt very bad. How do I prevent this?
Thank you for the question, Olivia. So it's without doing a history physical and knowing much about the medical history, I couldn't say for certain what you're going through, but it sounds like you might have something called a trigger finger. And trigger finger is a problem with the tendons in our hand. It affects about 2% of the population, so fairly common for folks. The frustrating thing is we often don't know what causes it. It can happen spontaneous without an injury or really anything that we can point to. We do tend to see it in patients that have diabetes or a certain type of arthritis like rheumatoid arthritis. So if this is trigger finger, there are a few things that you can work with your doctor on. Typically we start with things like pain and anti-inflammation medications, some splinting on the affected finger as well. If that's not working, a next step would be something like a steroid shot or injection. And then if a few of those aren't working, you can talk to your hand specialist or your doctor about surgical procedures as well. But I will say it's important to make sure that it isn't anything else because there's certain types of hand infections, arthritis, and other types of conditions that can also look a lot like trigger finger.
Oh, okay. So let's talk now about colon cancer. It's the time of year, the month where we try to raise awareness about that, inform people. So a question here, should I be screened for colorectal cancer?
Yes, you're right. This is National Colorectal Cancer Awareness Month, and we know that colorectal cancer screenings save lives. And the sad reality is that colorectal cancer is one of the leading causes of cancer deaths right here in the U.S. So if you're 45 years or older, get with your doctor and get screened for colorectal cancer. There are many options out there. Some are stool-based testing, some that you can even complete in your home and mail off to a lab. But our gold standard is the colonoscopy. This is a lighted tube that can look on the inside of the colon, and if we see any signs of precancer or these growths, not only can you identify them, but you can remove them. And that's what we want to work for, is to try and prevent cancer and try to identify it in an early stage where treatment is more effective.
Are those the only two options?
There aren't. There are a few others. In fact, in the stool studies, the stool-based studies, there are a few that folks can connect with their doctor on to learn a little bit more about those details. There's also another type of, that's called a sigmoidoscopy, similar to a colonoscopy, but doesn't get the entire view of the colon. And then there's what we can call kind of like a virtual colonoscopy that uses things like X-rays to create a digital image of the colon.
And you were saying before that it's younger people that you're finding.
Well, we are
more diagnosed with this.
Yeah, I do want to ensure that we are, connecting with the younger folks, particularly my generation, the millennials. What we've seen from the mid-90s to now is that it's been about a 2% increase in cancer, in colorectal cancer, in those under 50 years of age. So if you have risk factors, things like having a family member who has colorectal cancer, or you're concerned about it, connect with your doctor, because you might benefit from screening at a younger age.
And especially for the younger folks, you say the word colonoscopy. People get a little worried about that. It does not sound pleasant. But what would you tell somebody about what this procedure really involves, and especially any kind of recovery afterwards?
Sure. What I would say is the colonoscopy is such a powerful tool that has the ability to save lives. And sure, I know folks are concerned about taking the prep work before, and that may be causing some discomfort. But the reality is this can save lives. Definitely connect with your healthcare team to see about getting your screening for colorectal cancer.
Do we know why this is happening? Why so many people are being diagnosed with this?
That's an excellent question, particularly on the younger folks. Scientists are working hard to try and find some answers. There are a few opinions and theories that are being tested. We don't know for sure, but folks are on the case and exploring that question.
Okay,
All
thank
right.
you.
Yeah, Dr. Lopez, thanks for joining us as always.
Thank you for having me.
See you next time here on Doc Talk. And if you have a question, let us know. You can go to our website, scan this QR code here, send us your questions. We take them straight to doctors to bring you answers. We do this every Thursday right here at 6:30.